Welcome back to the deep dive. Today we're digging into something specific you might see on a vet report, right? Bundle branch block, or RBBB. This is for dogs and cats.
That's right.
You sent over some really interesting sources on this, and well, our mission today is to kind of break it down. What is RBBB? What causes it? Does it matter? Or, sometimes maybe not. And what does it mean for the animal? We want to get you up to speed clearly and quickly. Okay, let's unpack this.
Sounds good. Yeah. RBBB, it's a finding on an ECG, an electrocardiogram. And it does sound a bit worrying, doesn't it? That word block.
Right, yeah.
But like the sources point out, what it actually means can vary quite a bit. To really get it, we probably need to start with the basics, like how the heart's electrical system normally works.
Okay, yeah, the heart's wiring. So the main spark, it starts high up in the heart, right?
Yeah.
The SA node, the natural pacemaker.
Exactly.
And that signal spreads across the top chambers, the atria that makes the little P wave you see on the ECG trace. Then it hits like a checkpoint, the AV node.
The AV node.
The AV node.
Little delay there.
Before it goes down the main highway, the bundle of His.
Yes.
And this bundle, it splits left and right branches.
Yep. Left and right bundle branches.
Which then spread out through tiny little wires, the Purkinje fibers, to zap the bottom chambers, the ventricles.
Perfect. And normally that signal zips down both branches super fast, so both ventricles get the message almost simultaneously and squeeze together. Nice and synchronized.
And that quick, coordinated squeeze gives you that sharp, narrow QRS complex on a normal ECG.
Precisely. Now, with right bundle branch block, there's a hiccup, a delay, or, well, a block along that right branch wire.
Okay.
The initial signal still comes from the top, totally normal from the SA node usually. But when it tries to go down that right pathway to activate the right ventricle, it's slowed or stopped.
So the left side gets the message on time, starts pumping.
Right, on schedule. But the right ventricle signal, it has to take a detour. It has to spread more slowly, kind of cell by cell, across the muscle from the already activated left side.
Ah, so the left side's done its thing, and the right is lagging behind, taking the local roads instead of the highway.
That's a great analogy, yes.
Yeah.
And that slower cell-to-cell spread just takes longer. So the total time it takes to get both ventricles fully activated, depolarized, is prolonged. That's the core issue.
Gotcha. And the sources mentioned complete versus incomplete RBBB?
Yeah, that refers to how significant the delay is. Complete RBBB means a major delay, so the QRS complex on the ECG looks quite wide and often has a really distinct abnormal shape. Incomplete means the delay is there, but it's less pronounced. So the QRS is wider than normal, but maybe not dramatically so.
Okay, degree of delay. And you stress that the signal still starts up top supraventricularly. Why is that so key?
Oh, it's crucial. Because RBBB is a problem with conducting a normal impulse down into the ventricles, it's fundamentally different from rhythms that start abnormally within the ventricles themselves, like ventricular premature complexes, VPCs, or ventricular tachycardia, VT. Those VPCs and VT, they often pop up spontaneously from irritated bits of the ventricle muscle, kind of rogue signals. They have different causes, different implications, often more serious. RBBB is about a delay in the normal pathway within the ventricle, but triggered from above.
Right, so distinguishing between them on the ECG is vital.
Absolutely. Which leads us to, how do you tell? What does RBBB actually look like on that ECG strip?
That's the definitive tool, isn't it, the ECG? So what are those telltale signs?
You're hunting for a specific pattern. First, evidence that came from above that supraventricular origin. That means you should see a P wave, the little atrial bump, right before every single one of these wide QRS complexes.
A P for every wide QRS.
And importantly, the timing between the P wave and the start of the QRS, the PR interval, should be pretty consistent, beat to beat. This is a huge clue, because with VPCs or VT, you often don't see a P wave right before, or if one happens to be there, it's not related. The timing is off.
Okay, check for the P wave leading the charge. What next?
Well, QRS itself is the main event. It's wide. It takes longer than normal for the ventricles to fully activate. The sources give slightly different cutoffs, but generally think wider than maybe 0.07 or 0.08 seconds in dogs and over 0.05 or 0.06 seconds in cats. Definitely prolonged.
Wider than usual. Got it.
And then there's the shape of it, the morphology.
Yeah.
Because the right ventricle is activating late and abnormally, the tail end of the QRS complex looks funny.
Funny how?
Well, you might see what's called an RSR pattern. Sometimes looks like bunny ears on the trace. Or you might see a really wide, kind of slurred S wave, especially in the leads looking at the bottom of the heart, like leads 2, 3, and AVF.
Oh, okay.
Another common thing is a noticeable positive deflection, an upward bump right at the end of the QRS in leads, pointing towards the right side of the heart. or a downward deflection at the end in leads looking away, like lead 1. That final part of the complex is broad slurred because it represents that slow, delayed right ventricular activation.
And the sources had pictures of this, right? Showing those big, wide S waves.
Exactly. Seeing that specific shape combined with the wide duration and the consistent P waves with a fixed PR interval, that whole package is what screams RBBB. And it helps you differentiate it from VPCs or VT, which are usually premature and lack that reliable P-wave link.
Now, here's something really interesting. One source mentioned this Ashman phenomenon mainly in cats. What's that about? It sounds like a blip.
It is kind of like a blip. The Ashman phenomenon, it's basically a normal beat coming from the top of the heart that gets conducted weirdly down to the ventricles, aberrantly conducted.
Yeah.
And it often takes on that RBBB shape.
Okay. Why does it happen?
It happens specifically after a pause, like a long gap between heartbeats followed immediately by a short gap, a long RR interval, then a short R. When the heart suddenly speeds up like that after a pause, the right bundle branch sometimes takes a fraction longer to electrically recover to reset itself than the left side does. So if the next beat comes along really quickly after that pause,
it arrives while the right branch is still kind of recharging, still refractory.
Exactly. So the impulse can't get down the right side normally. It results in a temporary RBBB pattern for just that one beat. It can look just like a VPC, which might seem worrying at first glance.
Ah, okay.
But because it happens in that specific long-short sequence and originates from above, vets recognize it as an Ashman beat. It's generally considered harmless, benign, not a sign of ventricle problems like a true VPC might be, just the wiring getting momentarily caught out by a rhythm change.
Fascinating little quirk, especially for cats. Okay, so we know what RBBB looks like on the ECG. Now the big question, the why. What's actually causing this delay?
That's the million-dollar question, really.
Yeah.
Because as the sources stress, finding RBBB can mean very different things. It might be completely incidental, just a variation in a healthy animal.
It's how they're wired. Sometimes, yeah. We call that functional or physiologic RBBB. It's seen sometimes in perfectly healthy pets, especially, the sources say, in large breed dogs. Maybe because their right bundle branch is just anatomically a bit thinner and longer, making it more prone to slight delays that show up on the supersensitive ECG. Interesting. It's actually noted as the most common conduction issue like this found in dogs. Less common than another type, left anterior fascicular block, in cats, but still seen. It can also be weight dependent. Meaning it only shows up when the heart beats fast, like during exercise or excitement. Again, the fast rate catches the right bundle branch before it's fully recovered, causing a temporary block. If the heart slows down, it goes away.
So in those cases, it's not necessarily a disease state.
Right. But then there's the other side of the coin, structural or pathologic RBBB. This means there is an underlying problem. Something is physically damaging or stressing the right bundle branch or the right side of the heart muscle itself.
Okay, now we're getting into the concerning reasons. What kind of structural problems?
There's a whole list. A big category is anything causing right ventricular enlargement or overload.
Yeah.
Basically, conditions that make the right side of the heart work too hard or handle too much blood.
Like what?
Well, classic examples are pulmonic stenosis. That's a narrow valve, leaving the right ventricle, making it strain against pressure. Severe heartworm disease is a big one, clogging up lung arteries and putting immense strain on the right heart. Also, tricuspid valve disease, where the valve leaks blood backward, overloading the right side. And pulmonary hypertension, high blood pressure in the lungs from various causes, again makes the right ventricle struggle. Even some congenital defects like ventricular septal defects, VSDs, holes between the ventricles, can overload the right side.
So anything that stretches or thickens that right ventricle muscle could affect the wiring running through it.
Pretty much. Or puts direct pressure on the bundle branch. Other causes involve the heart muscle directly. Myocardial disease, like dilated cardiomyopathy, DCM in dogs, where the muscle's weak and thin. Or hypertrophic cardiomyopathy, HCM, in cats, sometimes involving scar tissue, fibrosis that disrupts electrical flow. Myocarditis, which is inflammation of the heart muscle, can also damage pathways.
What else?
Cardiac tumors, so neoplasia, near the right ventricle or the wall between ventricles, can squeeze or grow into the bundle branch, just age-related scarring, fibrosis in the conduction system.
Any outside factors, like trauma?
Trauma's mentioned, yeah. Severe chest trauma could potentially damage it. And interestingly, iatrogenic causes, meaning caused by medical procedures, things like cardiac surgery, or even rarely getting a blood sample directly from the heart. The second source adds a few more. General congenital heart disease, chronic valvular fibrosis developing over time, a specific infection called Chagas disease from the Trypanosoma cruzi parasite in certain regions, and even acute thromboembolism, like a sudden blood clot in the lungs causing immediate severe right heart strain.
Goodness, that's a really broad range of possibilities, from possibly nothing serious to, well, quite serious.
It really underscores why finding RBBB is just the first step. You have to figure out which of these, if any, is the cause. And again, that anatomical point comes up. The bright bundle branch is just this thin, long strand, making it a bit more vulnerable structurally.
Okay, so it shows up on the ECG. We have a long list of potential whys. But what does the animal experience? Does RBBB make them feel sick? What signs might an owner actually see at home?
That's a super important point the sources make very clear. RBBB itself is usually asymptomatic. It typically doesn't mess with the heart's pumping ability enough to cause noticeable problems on its own.
Really? So if the pet seems fine, the RBBB might just be there.
It could be. If it's that benign variant we talked about, the animal likely shows no signs whatsoever. It's often found by chance on a routine ECG.
So if there are signs, it's probably the underlying disease causing them, not the RBBD pattern.
Exactly that. Clinical signs, when you see them, are almost always due to the primary cardiac condition or systemic illness that triggered the RBBB. The RBBB is like a clue, a signpost pointing towards that deeper problem.
Okay, so what are those signs? The signs of the underlying problem that might accompany RBBB?
Well, if there is an underlying issue, you might notice things like the animal tiring more easily on walks, exercise intolerance, maybe just general lethargy or weakness.
Yeah.
Syncope, actual fainting can happen, but usually only if the underlying heart disease is pretty severe and impacts blood flow dramatically, or if there's another serious rhythm problem going on at the same time, like a very slow heart rate from high-grade AV block.
So fainting is a bigger red flag.
Definitely. Other signs often relate to congestive heart failure, especially right-sided failure, so faster breathing rate, tachypnea, or visible difficulty breathing, dyspnea. This might be from fluid backing up. The sources note coughing is less common in cats with heart failure than dogs.
Okay.
You might see ascites a swollen belly due to fluid buildup with really chronic severe disease, maybe weight loss or poor appetite, anorexia. Very severely affected animals might show cyanosis, like bluish gums from poor oxygenation.
And what might the vet pick up on exam?
The vet might hear a heart murmur or detect another arrhythmia while listening. They might see jugular vein distension or pulsing in the neck, another sign of pressure backing up on the right side. And that other source mentions sometimes hearing a splitting of the heart sounds because the ventricles aren't contracting quite together.
Right, that makes sense. One beat slightly after the other. So finding RVBB is step one, the ECG clue. Then it's detective work time to find the why. How does that investigation usually proceed?
Absolutely. It kicks off a diagnostic workup.
Yeah.
You have RBBB from the ECG. Now you need to find the cause or confirm there isn't a serious one. It starts with a really thorough history and physical exam.
Gathering all the clues.
Right. Asking about symptoms, onset, progression, lifestyle, diet, medications, previous issues. Then the physical exam, listening carefully to heart and lungs. Feeling pulses, checking gum color, feeling the belly for fluid, the whole 9 yards.
And the ECG again, presumably?
Yes. The electrocardiogram is key not just for the initial diagnosis of RBBB, but also to analyze the whole rhythm, look for other abnormalities, and really confirm it's not VPCs or something else causing those wide beats by carefully checking for those P waves and the PR interval.
Makes sense. What about looking inside? Imaging?
Advanced cardiac imaging is usually the crucial next step. Thoracic radiographs, chest x-rays give you the big picture. Heart size and shape overall, the state of the lungs looking for fluid, suggestive of heart failure, checking for fluid elsewhere. They can give hints about right ventricular enlargement.
But for the fine details of the heart structure.
That's where echocardiography, the cardiac ultrasound, is essential. It lets the vet actually see the heart muscle, the chambers, the valves, working in real time.
What can they see specifically?
They can measure chamber sizes, especially the right ventricle and atrium, assess how well the muscle is contracting, look closely at the valves for problems like pulmonic stenosis or leaky tricuspid valve. Identify congenital defects like VSDs, spot any masses or tumors. They can even estimate pressures in the pulmonary artery to check for pulmonary hypertension.
Wow, okay.
And one source specifically mentioned, if the echo and the x-rays look normal, if there's no sign of right heart enlargement or structural disease, that strongly points towards it being that benign, non-pathologic RBB.
That's a really key finding or lack of finding. What about blood tests?
Blood tests play a role too. Standard panels like a CBC and serum chemistry check overall organ function, look for systemic illness. And critically, they measure electrolytes, especially potassium.
Ah, right. You mentioned hyperkalemia before.
Exactly. Severely high potassium, particularly in cats with, say, a urinary blockage, can cause all sorts of conduction problems, including wide QRS complexes that can look like or happen alongside RBBB. So checking potassium is vital.
What else from blood work?
A heartworm test is absolutely crucial in areas where heartworm is common, given its link to right heart disease and RBBB. Sometimes cardiac biomarkers are used tests like proBNP or troponin I, which can indicate heart muscle stretch or damage, helping if primary heart muscle disease is suspected.
And that Chagas's test.
Yeah, if the dog lives in or has traveled to an area where Chagas disease occurs, testing for that Trypanosoma cruzi parasite is important if there's unexplained heart disease, RBBB included.
Okay, so we've done the detective work, we have the RBBB diagnosis, and hopefully we know the underlying cause or lack thereof. Now, the big question for the owner, what's the treatment?
And this is probably the most critical management point from the sources. You treat the underlying cause. You don't typically treat the right bundle branch block itself.
Because the block itself isn't usually the problem.
Exactly. Since isolated RBBB generally doesn't cause significant hemodynamic issues, doesn't impair blood flow enough to cause symptoms, there's no specific treatment needed for the block. The focus is entirely on managing whatever condition led to the block appearing on the ECG.
So what if the workup finds nothing? It seems to be that benign type.
If it's asymptomatic RBBB with no detectable underlying disease after a full investigation, normal echo, normal x-rays, etc., then the sources say no specific treatment is necessary.
Okay.
Maybe just monitoring regular vet checks, perhaps repeat ECGs down the line just to be safe, but usually no activity restrictions, no special diets just for the RBBB. The animal can often just live a normal life.
That's good news for those cases, but what if an underlying problem is found?
Then you absolutely treat that primary disease, and the treatment plan will vary hugely depending on what it is.
Like the examples you gave earlier.
Right. If it's pulmonic stenosis, maybe surgery, or a balloon procedure to open the valve. If it's heartworm disease, you treat the heartworms. If it's congestive heart failure, you manage that with medications, diuretics, ACE inhibitors, pimobendan, drugs to help the heart cope. If it's hyperkalemia, you fix the cause, like unblocking a cat's urethra to normalize potassium. If it's a tumor, maybe surgery or chemotherapy or just palliative care. Myocarditis might need anti-inflammatories or antibiotics. You treat the root cause.
What about specific heart rhythm drugs or pacemakers?
Good question. The sources emphasize that antiarrhythmic drugs are generally not needed for isolated RBB. They'd only be used if there are other more dangerous arrhythmias happening at the same time that do need controlling, like frequent VPCs or runs of VT.
And pacemakers.
Also rarely indicated just for RBBB. Pacemakers are for hearts beating too slowly and causing symptoms like fainting from severe AV block. If an animal has that kind of problem and happens to have RBBB, they might get a pacemaker for the slow heart rate, but the RBBB itself doesn't warrant one.
Okay, that clarifies treatment focuses on the cause. So wrapping that thought up, what does this mean for the prognosis, the long-term outlook?
Well, as you'd guess, it's highly variable. It really hinges entirely on what the underlying cause is, or if there even is one.
So best case scenario.
Best case. The RBBB is an incidental finding in a healthy animal. No structural disease found on workup. The prognosis there is generally good. Normal lifespan, normal quality of life expected.
That's great. What about when there is heart disease?
Then the prognosis is variable. It completely depends on the specific condition, how severe it is, and how well it responds to treatment. If you can effectively manage the underlying pulmonic stenosis or heartworm disease or heart failure, the outlook improves significantly.
And when is the outlook more guarded?
The prognosis is typically guarded to poor if the RBBB is associated with severe, advanced, or untreatable disease, like end-stage cardiomyopathy or an aggressive cardiac tumor, or if it occurs alongside those symptomatic slow heart rhythms, like high-grade AV block causing fainting. It's also worth noting, one source mentioned, the underlying lesion causing the RBBB could potentially progress over time, maybe leading to more widespread conduction problems or even complete heart block later on. And seeing other conduction issues like first or second degree AV block along with RBBB might suggest the problem isn't just isolated to the right bundle.
That makes sense if the initial damage is part of a bigger issue. Okay, just quickly before we wrap up, any major differences between dogs and cats that stand out from the sources?
Just a few nuances. It happens in both, for sure, but maybe it's slightly more common to find it as a benign, isolated thing in healthy large dogs compared to cats, although it can be benign in cats too.
And the common causes differ a bit.
Yeah, the emphasis shifts slightly. In dogs, you might think first about pulmonic stenosis, heartworm, DCM. In cats, you definitely have hyperkalemia high on the list, especially with urinary issues, and also HCM. And that Ashman phenomenon is more of a feline discussion point.
Right. Any difference in how they might present?
Just that cats can be masters of hiding illness. So the signs of underlying heart disease might be more subtle initially in a cat, maybe just breathing a bit faster or being a bit off their food, making it sometimes trickier to pick up early compared to a dog showing obvious exercise intolerance.
Got it. Wow, this has been quite the journey. We started with this ECG finding, RBBB, peeled back the layers on the heart's electrical system, looked at the specific ECG clues, explored that whole wide range of causes from, maybe nothing to worry about to definitely something serious. We talked about the signs, realizing they usually point to the underlying problem, walked through the diagnostic steps, and landed on treatment and prognosis being all about tackling that root cause.
Yeah.
I think the biggest takeaway is that RBBB is an important signal on an ECG, but you can't judge its importance until you know the full story. That thorough workup is key.
Absolutely. And what's really fascinating here, I think, is how this one specific electrical pattern, this block, can represent such different realities. Sometimes it's just normal for that individual animal, completely harmless. Other times it's a vital warning sign, pointing towards significant hidden disease that needs urgent attention.
Yeah.
It really highlights how, in medicine, context is everything. You can't just look at one test result in isolation. You need the whole picture. And it raises an interesting question maybe for you to think about. For vets, for owners, how do you strike that balance between being diligent, investigating potential problems thoroughly, but also avoiding unnecessary worry or procedures when a finding might actually turn out to be clinically insignificant in the end?
That is a really thought-provoking point to end on. Thank you so much for sharing the sources and diving deep into this with us today. And thank you all for listening. Keep exploring, keep asking questions, and we'll catch you on the next deep dive.